through it really, really, really fast. I just remembered I actually haven't even introduced myself properly on the, because I've talked to all of you individually, but as a group, okay, I am the founder of Learn-Ayurveda and Yoga Academy. I founded with my husband, Pandit Atul Krishna Das. In 2007, we started the San Diego College of Ayurveda. We incorporated it in 2009. And then we've been running, Sudevi was one of the first Ayurveda practitioner graduates, along with Dr. Aparna. And one of the reasons we started was we were very passionate about Ayurveda, and we wanted to make the knowledge more accessible. But, you know, being Indian, we also wanted traditional Ayurveda, not the mixed. We wanted very traditional Ayurveda education. So when I started, I had no idea where it was going to go. And then last year we came here to Austin, Texas, and we founded Learn-Ayurveda and Yoga Academy, different entity. And you are the second group of Learn-Ayurveda and Yoga Academy. We had the one group earlier this year. So that's it about me. I have my own little Ayurveda center here in Austin. I had my Panchakarma clinic back in San Diego. And yeah, I am one of the few people whose full-time job is Ayurvedic education, although I refer to myself as an administrator. But yeah, it's my full-time job, 60 hours a week. And that's it. And today is a good day. It is Ekadashi, or the 11th day of the moon, 4 days before full moon or Purnima. So it's a nice day to start your education. This particular presentation that I have in front of you, I had given a lecture for Radies Children's Hospital. I'm not even sure if you know where that is. It's one of the biggest children's hospital. I don't know if it's all over, but in California, it's pretty big. And they were these specialists who specialize in gastrointestinal issues in children. So these were these, and they had a little integrative conference. So they had invited an acupuncturist, they had invited me, they had invited some Reiki healer, they had invited someone who was a yoga therapist, and we had all talked about digestion in children. And how it can be, and trust me, you have 43 specialist MD sitting in front of you, and they all had the expression, "This is nonsense." So this is exactly what I had used for them. So there's two things. I don't know how many of you started reading my book, Essential Guide to Ayurveda. It's going to be published in Kindle if you want to download it from there. But we've already shared the PDF with you. That's why it doesn't have page numbers in it. It's on the workspace. So yeah, this is it. And one of the things on the page 2 or page 3 or 4 I talk about, there is the introduction to Ayurveda for yourself. What is Ayurveda? For example, many of you went to a yoga class and you were introduced to Ayurveda in a yoga class. Somebody was introduced by the professor in a college. I was reading in the forums. And Ayurveda that you will introduce to your clients, to your family, you will tell them, "Oh, you know, I'm studying Ayurvedic medicine." So they'll say, "What is Ayurvedic medicine?" And then you'll explain to them. So that's the client facing. But when you and I and the community within Ayurveda talk about Ayurveda, it's a different, the way we talk, we have a different jargon, just like in any profession. So I hope this presentation, very, very similar to what Sudevi did, addresses that. So another thing that I'm trying to do is that I want to talk about what is my expectation. And all of these, I also talk about overview of Ayurveda in India and challenges in the United States. And then we'll do a little bird's eye comparison with other holistic health modalities as we move forward in the course. Principles of prevention and imbalances, concept of ahar and vihar, lifestyle. So think of it this way. In Ayurveda, we are giving 2 basic interventions right in the beginning. And these are not invasive interventions. These are lifestyle interventions. I'm just going to write that down. The interventions are lifestyle interventions. And this is called vihara. And then you have a diet intervention, and that is called an ahara. And then you have herbs, then you have the yoga, then you have mantra, you have meditation. Again, if you've read my book, I mention in it, there is no, if you look at a naturopathic doctor, that's all they do. They're just a naturopathic doctor. They don't have to wear 20,000 hats. As an Ayurvedic doctor, as an Ayurvedic practitioner has to wear many hats. Friend, counselor, practitioner, herbalist, yoga teacher, meditation teacher, dosha diet specialist, lifestyle specialist. So there's all these hats that you wear that you will not wear in any other modality. And once you get into Ayurveda, you can't just do anything else. It just takes you over. Oh yeah, and one more, massage therapist, if you are a massage therapist, because I also do that. All right. We already did this. So Ayur asmin vidyate, that is what Ayurveda is. Iti Ayurveda. Ayur ismin vidyate. Ayur is coming from the word ayush, which means life. And as you go in, there are 4 types of lives that are described. Hitayu, ahitayu, a lot of Sanskrit words, just digest it. Ayu, life. Hitayu, auspicious life. Ahitayu, inauspicious life. We talk about that. And Veda comes from the word Veda, means to know. And that is what becomes Ayurveda. Remember, when Ayurveda was written, it was not called Ayurveda. When the 4 Vedas, that when they were written and they were manifested thousands and thousands of years ago, it wasn't called Ayurveda. It was just many thousands of Sanskrit verses in one of the 4 Vedas. And then in Charak Samhita you see the Ayurveda. I'll talk about Charak Samhita in a second, because Sudevi was mentioning about Acharya Charaka. So we will use the word guru or acharya for charaka instead of just calling that book author charaka. We don't do the charaka book author. We call them acharya or guru or master. So just to give them honor, because if you don't honor our masters and our teachers, then the knowledge is not going to manifest in us. Very simple. So I'm giving this lecture to, or I have this in front of all these physicians, and this is the kind of thing I was telling them. But this was the most important portion in this entire Vedas, because these people are specialists in digestion, in the bowels, so I told them that disease begins when digestion is imbalanced. That is why we are called Agni Chikitsa or Kaya Chikitsa. I'm going to write that down here. That's what we do. Just to give you an example, 3 people walk into a doctor's office, and this is an Ayurvedic doctor, right? And person number 1 has a headache, and this is a Vata person. And person number 2 has congestion and is very kind of low energy, is sleeping 10 hours a day. And person number 3 is sweating a lot and has some skin issues, and skin is very red, and the temperatures, it doesn't have a fever, but overall the body temperature is slightly elevated. And so what is happening? So this Ayurvedic doctor answers person 1 who is constipated, a person 1 who has headache, say, tell me about your bowel movements. And the person 1 with the headache says, oh, you know what, I'm constipated, and I go, I have a bowel movement once in 3 days. And the Ayurvedic physician, the Vaidya, gives them a triphala or senna and asks him to drink milk with ghee at night and say, do this and your headache would be better, and see me in 2 days or 3 days. He asks the person who's kapha, who is congestion, tell me about your bowel movements. And this kapha person who is very congested and kind of sleeping 10 hours a day says, well, I have one bowel movement, but I also have a little, kind of looks like spit in my stool. So this person is getting mucoid stools, mucus in stools, and says, oh, here, let me give you this herb. It is called triphala, and this herb, this is called trikatu, and do not drink milk, and do not have, just have some soup for 2 days and have these herbs, and only clear soups for 2 days, just clear vegetable soups or clear mung dal soup and nothing else. And then I'll see you in 2 days. You should feel better. And the third person who has some skin issues and who is, body temperature slightly elevated, the Ayurvedic physician asks, oh, tell me about your stools. And the person says, oh, I go 3 to 5 times a day. My stools are slightly soft. They're yellowish. And there's a burning sensation. Here, take, drink some lassi, drink some takra, and here take some rose jam, and here take some amalaki and ghee, and see me in 3 days. What just happened here? What just happened here? Anybody? I'm going to stop sharing and start video for a second. So can anyone tell me what just happened here? Just put in the chat window. So 3 people come, 3 persons. Exactly. Person 1, no, but each one of them were a different person with a different issue. Yes. Even though there were 3 people, and these 3 people had different issues. Yes. One had a headache, one had congestion, and one had skin issues. But all of them were asked their Agni or digestion first. Not treated as per dosha, Robin. Treated as per digestion. Digestion is more important than dosha, or its most important part. Does it make sense? Okay. So Agni is more important than dosha. So when we do a dosha test, the Agni portion is the only portion we are really interested in, because the entire Ayurveda, what we practice, is based on Agni Chikitsa. It's not based on Agni is most important. Disease begins with Agni. There we go. Here again. Make sense? Process of disease begins with Agni. This is why if we can find out, because Ayurveda is non-invasive. Tell me about your stools. Tell me about your urine. Tell me what kind of, how many bowel movements you have a day. That is going to tell me what is happening inside your body, what is happening inside your GI tract, what we call Annavaha Shrotas. And that is going to tell me what I need to work on. If we could nip the digestive issues in the bud, disease will not begin, according to Ayurveda. I'm not talking about the kind of problem where someone has, an accident or a trauma and they're bleeding, not that kind of thing. We are talking about process of disease internally, Agni Chikitsa. Does that make sense? Does it make sense? All right. So again, what is it that an Ayurveda, how many of you have actually had have actually been to an Ayurvedic doctor or Ayurvedic practitioner and have had, how many? Two people? Just put it in there. Yes, no? You see that? Yes, no. If you click on this, I will know how many people. So all right. So Mandy, you have been to an Ayurvedic practitioner then, right? Of course. Sean, you have. So nobody is actually, Cliff, you have, Megan, you have, Morgan, you have. Yeah, because you went to okay. Who, it says owner, so I actually don't know who you are. If I could have your name, please. On Ontario, Ashley, you can go to Rasamai. Rasamai Victory. She's my student. She just finished Ayurveda practitioner under me. Rasamai Victory. Tell her you're from Narayana Ayurveda. Yeah, she's in Ontario. She's in Toronto. She's in Toronto. Also, you can go to Sangeeta Agara. Again, she just graduated. Awesome Indian, great herbalist. So Rasamai is a practitioner and Sangeeta is a counselor. So these are two people. I know. All right, multimodal approach. So what is it when an Ayurvedic, like I said, 3 people came to me. One had a headache, one had congestion, and one had skin issues. And of course, Ayurveda practitioner is going to first address their digestion. It doesn't mean we are not going to address the congestion portion or the skin or the headache. We will, but the first thing we address is the Agni. So to address the Agni, we give diet plans that we call Sanskrit word. I'm going to write it down. Remember, Patya and Apatya. Patya means do's and don'ts. Patya is the kind of things you have to eat, and apatya the kind of things you eat this, don't eat that. Eat this, don't eat that. Do this, don't do that. Do that, don't do this. So that's all it means. So diet plans suited to dosha or prakriti. Yoga. This is not a yoga class. You give a few yoga poses. Just to give you an example, just yesterday I had a client who had who did not have fibromyalgia. Well, she had it checked out for all kind of issues. She was just had a lot of pain in her body, and so I gave her like 4 yoga poses because of the pain. She couldn't go to a yoga class. So 4 yoga poses is all we gave. And then she tried to do Surya Namaskar, sun salutation. And I said, absolutely not. You're going to do gentle things with like 5 pillows because there's so much pain. There is no way you're going on the ground. So yeah, yoga plan, but not everybody can do that. Pranayam is again part of yoga, but of course Ayurveda uses pranayam or breathing exercises. Yesterday with Sudevi, we had an awesome pranayam class. We actually did pranayam online, every one of us. It was beautiful. So pranayam is used because not everybody can be a yoga teacher, but Ayurvedic practitioner can learn pranayam and teach pranayam. And most of the 200-hour yoga teacher training do not have the bandwidth. I know we have a yoga teacher training, but it's just us. We give a lot of emphasis on teaching pranayam because we are an Ayurveda college. But most of the yoga teacher trainings do not have the bandwidth to teach all the pranayam. Surya Bhed pranayam, Chandra Bhed pranayam, Nadi Shodhana, Bhastrika, Kapalabhati, all of these pranayam breathing exercises we'll actually teach. And we expect you to give a minimum pranayam, or at least we expect the Ayurveda counselor to know a master yoga teacher who can teach this. And it just, you go to the yoga classes, many, except for Ujjayi breathing, right in the beginning of the yoga class, which is a beautiful, powerful breathing, no doubt about that. They don't offer any pranayam because people are not coming for pranayam. So I encourage you, if you're a yoga teacher, or if you're doing a yoga teacher training, or you take a class, please offer at least a couple of minutes of pranayam at the end of class, and more than one, like alternate nose breathing, or Kumbhaka Rechaka, or Surya Bhed, or Chandra Bhed, or depending on, or Bhastrika, depending on what your class is, please offer pranayam. And those of you who are not yoga teachers, when you do the yoga therapy, we will be going through pranayam. Okay. Massage therapies, again, unless you are, unless you're a nurse, you have 2 nurses here, Laura and Mandy. Unless you're a nurse or unless you're a massage therapist, I'm not sure if anybody's a massage therapist. You can't really do this, but you can actually suggest someone. Like, yeah, I just got yesterday some Ayurvedic physician who has a client here in Austin, looked for me, found me, and talked to me, and then recommended his client to come to me. And that happens all the time. I also have medical doctors who practice Ayurveda. They'll look me up, they call me, and then they will talk to me to know what I'm doing, and they will suggest that their clients come and get this from me. So if you don't know anybody, we have another student in another group, the June group, and she is actually works in California with a doctor, an MD who incorporates Ayurveda and actually offers Abhyanga in the MD clinic. I also knew Dr. Kulreet Chowdhury. She just wrote that book, Prime. She used to send me her clients all the time for MS, multiple sclerosis, and ALS, and her patients for neurology patients. She would send for Ayurvedic treatments all the time. But then she also had someone doing Ayurvedic massage in her clinic as well. And then Shirodhara, not just Shirodhara, but Shirodhara, Nasya. Does everybody know what Shirodhara is? Yes, no, maybe? Okay. Marma point activation. So we have marmas on our body. There's 108 marmas. 107 are actual points. Some of them you cannot reach. Most of them you can. So these are meeting points of, or maybe arteries or muscle. For example, your nabi. All your chakras are also a marma. There's a beautiful video on our YouTube channel by Dr. Dhanada Kulkarni. She had done a 1 hour lecture. She had done a few hour lectures, and one hour of it I put on YouTube, and it's public. So if you are not subscribed to the channel, please get subscribed. So there's a beautiful lecture. I'll again share with you. You should probably watch it. Marma point activation is another thing that we do. Again, depending on what state you are in, if you don't have a massage license or you can't touch, you can't do that. But you can tell your client to touch those points themselves. You can ask your client to put essential oils on those points. That would actually also work. You can also ask your clients to meditate on those points as well. Taking herbal formulations internally. Now, Nama, if you look at the study guide for Ayurveda counselors, is about between 20 and 25 herbs that you're supposed to know. We start introducing to the herbs right from the beginning. In fact, your first assignment, first forum discussion is what are the herbs that you actually take internally, what Ayurvedic herbs you already know about. So that would be nice. Meditation. We have this whole lesson on meditation. Right now, in fact, the other group is doing, we're having discussions on different meditation for different kinds of people, because meditation is not created equal. And then spiritual prayers. And of course, I ask people, do you go to temple or do you go to church or, wherever do you pray? It is because praying is important. And if they don't pray or they don't believe it in, then, do you connect yourself to the universe then? In what way? And that is why it's a multimodal approach. So again, if you read my book, I have like 4 pages of this Ayurvedic medicine in India and US. And then the reason I incorporated it is because Ayurvedic medicine in India is a different modality. Ayurvedic medicine in the United States or Canada is a complementary health system, and Ayurvedic practitioners or doctors cannot diagnose, treat, or cure, or even prevent a disease according to FDA regulation. And depending on what kind of state you live in, a freedom state, health freedom state like California, where all you do is, you have a person sign, or if you live in Nevada, you can't even take the nadi. So we take nadi, so we touch the pulse. So unless you have most southern states, I see you guys, you can't do the nadi. I mean, depends on the state laws. If you have, can you get a disclaimer signed, and can you take the nadi or not? So depending on state to state, it's going to be different in US. In India, it is considered, it's a standalone. That means most of the Ayurvedic, first of all, right off the bat, Ayurvedic medicine hospitals exist in India with beds. We just had the big Ayurvedic hospital back in New Delhi. The chairman of that hospital had visited us at the NAMA conference in April this year, and it's a huge hospital with 1,000 beds. And they have X-ray, you have a lab. So Indian Ayurvedic doctors, they actually kind of have a integrative education of Ayurveda and Western medicine, and they can order lab tests and whatnot. They still cannot do things like give an anesthesia. Right now, it's in Indian courts whether to allow Ayurvedic doctors to do that. So what they do is usually Ayurvedic hospitals also have regular MDs on staff. So, those kind of therapies can be given. In India, and there's also quacks in India. Oh yeah, there's quacks. And some of the quacks are actually very knowledgeable, and most of them are not. So there's a lot of bad press. Indian government is doing a lot, but in India, there's one doctor, medical doctor for 10,000 people. So yeah, there are quacks. So this is why they have allowed insurance to pay for Ayurvedic medicine in India. And what that does is that kind of, encourages people to go to an actual Ayurvedic hospital instead of going to quacks. Let's come back to United States or Canada. Canada, I'm not really sure what's happening. I've sent people herbs and they've gotten confiscated by Canadian Customs. Don't even get me started on the Canadian Post. Things don't reach for 3 weeks. But if I've sent it, in like a spice box as a spice, it has reached. So there you go. Here it's a complementary medicine, and it differs from state to state. So most practitioners are also nurse practitioners, massage therapists, yoga teachers, dietitians. And the yoga teacher thing I've seen only in the last 5 years. See, yoga, there's 50,000 registered yoga teachers in the United States. If those 50,000 yoga teachers decide we all want to study Ayurveda, imagine where Ayurveda can go. It'll be awesome. But the thing is that yoga teachers do not have the knowledge of anatomy, physiology, pathology, and they do not have, so they have to get some extra, how shall I say, they can easily become an Ayurveda counselor, that's not a problem. But as you move on to Ayurveda practitioner, an Ayurveda doctor is already being introduced by NAMA. I was along with, certain group was one of the first group of people recognize my NAMA, the Ayurveda doctor membership. And now they're going to start Ayurveda doctor exam process. And we are actually going to get started right in November November. We are starting our conferences at NAMA where we actually start preparing the Ayurveda doctor exam. So exciting things. So where do you want to find out what's happening with Ayurveda in the United States? Go to this website, National Ayurvedic Medical Association. For now, level 1 is counselor 600 hour. And for now, Ayurveda level 2, they don't call it wellness, they call it Ayurveda health practitioner. And they call the level 1 Ayurveda health counselor. And if you take an exam, then you can use certified Ayurveda counselor and certified Ayurveda practitioner. And this can be between 1,000 and 1,500 hours, and this is 600. However, it's not going to remain the same. In the next 4 to 5 years, this is the plan, NAMA plan, that this counselor is going to move from 600 to 1,000 hours. Ayurveda practitioner is going to move from 1,000 to 2,000 hours, and Ayurveda doctor is going to be 4,000 hours. So 4 years and residency. There is only one school in the United States which actually offers Ayurveda doctor and has been approved by NAMA. It is in-house. It's called Alandi Ashram. It is a beautiful, beautiful school. I know Alandi Ma, consider her one of my teachers and guides. They are in, I think they're in Colorado, I'm not sure. And board examination for Ayurveda counselor began this year early. It was supposed to happen December. We had 4 or 5 students who took the exam while they hadn't even finished the counselor, and they all passed. Yay. So it's not as hard as it looked, but Ayurveda practitioner is going to be pretty hard. I've been part of the NAMA subcommittee for board exam for all of these, for the counselor, for the practitioner, and I'm also on the committee for Ayurveda doctor in the United States. So that is exciting. And it's exciting because every single Ayurveda school in the United States comes together for these things. So we are all working at it together. This is all something that she did, so I'm not going to repeat it. Yeah, so the Sankhya philosophy. Yeah, these are the things that she just talked about, but she didn't go. So theory of macrocosm and microcosm. How should I put it up in context? Is there any like kapha person here? Okay, how many, again, I'm going to stop sharing for a while. Okay, all the kaphas. There's only one kapha, there's only one person like me. Hey, Olivia, thank God. Another kapha. Welcome to the group. How many pittas? Morgan, you're a pitta. Okay, how many of you have noticed that when the minute, like kaphas, I know for no, I for myself, I can say, when it starts raining outside, my kapha goes high, I get congested. Usually, even before it rains and I'm inside the house or my office, I can tell it's going to rain because I start feeling the kapha rise up. And if you're a pitta, usually just before it's becoming summer, your pitta will rise even if you're inside the house in an air-conditioned environment. Has any pitta noticed that? It doesn't matter. You may be inside and the AC may be on full blast, but it's hot outside and you get hot, right? And similarly for a kapha person, if it's if kapha is, it's wet outside and it's raining, and a lot of my clients, because they have musculoskeletal issues, they will they will start having joint pain and so on. What about vata person? Vata will get high. How many of you live in a like a mountain area or up in high altitude? Has anybody flown to like New Mexico or a mountain? Especially if you're a vata, just being in a mountain area or in a high altitude, your vata is going to go up. So if you're a vata, and you go fly to such a place, A, in high altitude, the oxygen is thin. B, at high altitude, vata goes up. You can have nosebleeds. Just to give you one example, we had a NAMA conference back in 2012 at New Mexico, Albuquerque. And we have like 300-400 people there. And half of us flew in. We checked into our hotel and we all came out and all of us had a nosebleed. And then there was this guy selling ghee, and then all of us were putting ghee in the Q-tip, and we all had the Q-tip ghee in our nose. So everybody's vata went high, and it was like 117 degrees. It was heat and the high altitude. Do you know where I'm coming from here? That is your microcosm of macrocosm. Make sense? Okay, let's share the screen again. So the idea is whatever's happening outside in the universe is also happening inside. Let me give you one example here. This is kind of a different example. For example, we had the solar eclipse, right? And everybody was very excited about solar eclipse. According to Vedas and according to astrology, a solar eclipse is considered extremely inauspicious. And I remember our students were having discussions about what kind of bad omens will the solar eclipse bring. I actually had my kids at home. I didn't even send them to school. And we were sitting here chanting because it's considered so bad. Even before the solar eclipse happened. So all people who know about this, they were doing their thing. And then, ever since that happened, I mean, according to Jyotish, not everybody has to believe that, which is the science of Vedic astrology, it was a bad omen. So then you've had all these hurricanes and all these catastrophes that have happened, right? Now, even if the hurricane has happened in Texas, or it has happened in Florida, or it's happened in Puerto Rico, even if you're not too near it, maybe you're in the same state, whatever is happening in outside, it some level is going to affect you. Does it make sense? That is another way to also another way to think of it is, for example, you live in there's something called collective karma. So the karma of the state that you live in, the city that you live in, the country that you live in also affects you. So if it is said, if the king or the mayor or the governor or whatever you want to call it, um, if they are karmically they follow dharma, then people, the citizen who live in that state would be good. Again, just to give you one example, I live in Austin, and the Austin city has a law that you cannot cut an oak tree. Actually, you cannot cut any tree which is over 8 inches in diameter. So if you come here, it's like a green jungle out here. I love it. Not cutting trees is such a beautiful, auspicious thing. So it makes the karma of Austin really, really good. It's like a microcosm in Texas. Morgan, you got to come here. If you know what I'm talking about. Those of you who are from Dallas, have you been to Austin? I mean, you have Texas and then you have Austin. Similarly, coming from California, which people are a lot more aware. A lot of people are vegetarian. People are a lot more chilled. Coming from California, here different. Go to Canada, go to Mexico. Every country has its own energy. So if you move from state to state, if you move from country to country, that is another macrocosm that will affect you internally. Does it make sense? Not just at a physical level, but at an energetic level. That's what it means. So microcosm, what is happening outside? Desha, your state, your city, even your house. Suppose the house that you live in is very cluttered. That if you're in a room that is very cluttered, that is going to affect your health. You're in a nice room, it's nice and clean, and it's following the rules of Vastu or Vedic Feng Shui, that is going to affect you. That is another macrocosm of microcosm. Your environment includes your room, includes your house, includes the plot or plat of land that you're in, includes your city, includes your country. Okay. Theory of similar and dissimilar. If you know this theory, you will be able to make protocols for yourself. We had like Morgan, you're Pitta. Shan, you are Kapha. Cliff, I think you said you were Pitta. So whatever person is Pitta, you have to do the thing opposite to it. Pitta is heat, cooling, 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 cooling. Cooling, drying, cooling, drying, cooling, drying. If the oiliness is high. If you're Kapha, earth and water element, everything has to be the opposite. No earth element. No. So have you ever wondered why Ayurvedic practitioners, they will tell Vata persons or someone who's textbook Vata not to eat salads and raw food? Because raw food and salads are made of space element. And Vata is also a space element and air element. And salads are also space element and air element. So if you are space and air element and you're eating raw food, which is also space and air element, your Vata is going to go out of balance. And there's 80 Vata diseases and disorders mentioned. There is 40 Pitta diseases that are mentioned. There are 20 Kapha diseases that are mentioned. Hold the thought, Cliff. I'm going to answer your question as soon as I'm done. So hold the thought. This was already done. Let's go back here. So do you know when we do the so-called dosha test? This is what we're looking at, physical traits, and we are looking at Agni. So like I said, this was made for Radies Children's Hospital. So for their conference, that's why it's all by children. Thin, low body weight, creative, dry nasal crust and allergies, hard to sit still. Okay, I take that back. Every child has a hard time sitting still, but you have, I don't know how many of you have little kids or toddlers. A Vata child will just, it's really hard. I have one Vata Pitta child who's 3.5. He's like a little, molecule in, it's a little molecule in motion, non-stop. And then I have a Pitta Kapha child who's so different, he's 12. But you see that, dry hair, dry nails. And in India, or even in, I know Tegan, in a Native American culture, in different cultures, we oil our hair, we use herbs on our body, and also on children. But there is no concept of massaging, using oil, using herbs on children in the West. So children are constipated, they're just dried out. Of course, children are not going to drink water. They all drink juice all the time. And hard for them, you have to help them with that habit. And then, of course, this is also going to be seen in grown-ups, not just in children. Gas, bloating, dryness, again, the poor circulation, constipation, meaning going once in 3 days kind of constipation. Uh, they have less energy than usual, anxiety, moody when imbalanced, talks really fast. You know what I was going to, and also the cadence is affected by that vata. So, when you have a person who's really talking fast, I actually can tell what a person's imbalance is when they walk in. So you have a client that walks in, you sit down, you introduce yourself, do you like water? So tell me what's going on. And then they just, they start talking and they don't let you interrupt. And yeah, and I can now, I mean, I've been doing it so long, I can say, that's, we just have 40 minutes to go, and they just spend 20 minutes talking, then they'll be quiet. But when I started practicing, I didn't know how to stop a person and say, okay, you got to stop. And immediately I know they have a vata imbalance. So I have learned to say, excuse me, or sorry to interrupt. And that's something, once you become a counselor, you cannot let your client take control of the interview because they're there for an hour. But, you learn. Nourished by soups with ghee, olive oil, sesame, plant-based diet, good fats. Pretty much, also every single mental imbalance. Seizures, convulsions, epilepsy, MS, ALS, all of these are under depression, anxiety, clinical depression, psychological disorders. They are all usually, there's symptoms of other doshas too, but mostly they're all usually the number top thing, that dosha that is imbalanced. A lot more other things are going on. It's usually vata. Also post-traumatic stress disorder. Also a woman who's just given birth, postmenopausal. Definitely, as soon as a woman, depression and anxiety, as soon as a woman gives birth, vata goes crazy. Just think of all the space there is. There was a baby in there, and there was this bag filled with amniotic fluid, and the bag is gone, the water is gone, the baby is gone, and then there's all this pressure, and you can't get any sleep, and it's crazy. Yeah, vata goes out of balance. All of those can be nourished. Soups with ghee, of course. What kind of soup would be different by olive oil, sesame oil, plant-based diet. Like I gave you an example of the client who was having so much animal-based protein. Good fats, omega-3s. Avoid salad and raw food. Now, a woman who's pitta who has just given birth, a woman who's kapha who's just given birth, I'm talking about a vata imbalance irrespective of the dosha. Not talking about of only a vata person should have soup with ghee, no, this means if the issue or current imbalance is vata. Does it make sense? Because when you first learn about Ayurveda, it's true. If you're vata, you should have a vata diet, and if you're pitta, you should have a pitta diet. If you're kapha, you should have a kapha diet. But what if I'm kapha and I've had a baby? Then I need this too, just temporarily. However, the soup that I make for me, if I've had a baby, is going to be a vata and kapha balancing. But the spices that I use would be kapha spices. But if this is for a pitta person, the soup would be astringent, bitter vegetables with ghee, and the spices would be cooling spices. And for vata, it would be warming spices. But do you understand where I'm coming from? And of course, there's no way it's going to make sense right now. But here's a few herbs. Just print this out, stick it in your folder that you have, or download it. I do suggest you actually print this. That would be good. I've had other students tell me they print it, they put it there, because when you're making a protocol for your client and even for yourself, this really is a great um, resource. And I think also this was done already by Sudevi, so I'm not going to go, but just look at it. Loose stools, irritability, competitive inflammation in skin, pitta disorders, acid reflux, GERD, yeah, liver disorders, hot flashes, excess hunger, anything to do with gallbladder, liver, digestive enzymes, any transformation in the body, anything that has to transform. For example, endocrine system, our hormones, right? So that is a thing that happens as a transformation. But once the transformation has taken place, they need to move. The movement portion of the hormones is vata. The transformation portion is pitta too. Then you have the absorption. What makes things transformed and absorbed, that is pitta too. And again, please print this out. And I'm happy to answer any question. Location, do remember, this is a bird's eye introduction. We are going to have like a class on each of the slide page that we have. So 1 hour class on each of the slide page that we've had today. Like I said, we're trying to introduce you to everything that we're going to do in this quarter 1, and then we will do it. And then towards the end, we will tell you, this is what we did. So those of you who are in the corporate who do a lot of public speaking, first we're going to tell you what we're going to tell you, then we're going to tell you, then we're going to tell you what we told you. Same thing. So don't try and remember these things right now. That's not the point. The point is, print it out, save it, and let it digest. And it might take a couple of weeks to digest, and that's okay. Ayurveda believes food is medicine. Effective food is very important in the mind as well as the body. Ayurvedic diet is mostly lacto-vegetarian. So for a pitta person, lacto-vegetarian. For a kapha person, mostly vegetarian or vegan, kind of vegan, but goat's milk and honey is okay. Actually, honey, think of vegan with honey, kind of. That's what I am. I'm vegan with honey. Then you have lacto-vegetarian, and if you have a vata person, they need a little bit more protein, so it's kind of lacto-ovo-vegetarian. And if a person doesn't want to give their animal-based protein, then they can have, but try and avoid beef and no animal-based proteins at night. And the reason for that is animal-based protein at night is hard on the body, hard to digest. So the only animal-based protein that's not going to be super hard on the body at night is fish. Everything else is going to take forever to digest. I mean, imagine if there's a vata person who has constipation, they go once in 4 days, and then they eat beef or something like that. It takes 72 hours for that body to digest, because vata persons do not have enough digestive enzymes to start with, whereas pitta persons can digest a lot more. So we also consider something called prana. And as a general rule, organic plant-based foods, non-GMO, local are best. Again, I'm not going to do this. You already did this. Plus, we're going to do many classes on this in AC 102. And this is my last slide. Sama dosha, sama agni, sama dhatu, mala kriya. Sama dosha. Sama means same dosha, balanced dosha. Sama agni, balanced agni. Agni for vata, pitta, kapha person is going to be different. That means if you are a pitta, that means you have 2 to 3 bowel movements in a day. That is your agni, and that means you're normal. If I'm a vata and I tend to be constipated and I have to take milk with ghee or triphala just to have 1 good bowel movement a day, that is my balance. And if a third person is a kapha and they get 1 bowel movement a day and it's kind of slow and they have slow peristalsis, that's their balance. The balance for person 1 and person 2 and person 3 is different. We are not created equal. That is why the whole concept of a diet, let's follow this diet, it's going to make us so healthy. Let's follow that diet and this diet and that diet and this diet. It doesn't work, because we are all different. In fact, If you were following a diet which worked for you, let's say when you were in your 20s, I can assure you, once you've had a baby, it's not going to work for you. Once you're in your 30s, that's going to change. Once in your 40s, it's going to change even more. And as we hit perimenopause, oh boy, it's going to change. It's always changing. Agni is changing. Dosha is changing. So there's no one size fits all. You can't just say, I'm a Pitta, I should do this. I'm a Vata, I should do this. I'm a Kapha, I should do this. Let's follow. Does anybody remember, everybody was following that so-called diet where everybody was supposed to have animal-based protein and nothing else? I don't want to name those diets, but you know what I'm talking about? So all these diets, it's not, that's why there is no single diet that has ever been successful. There was this low fat diet in the 80s. Then there was the, there's a something keto something diet I'm not going to name. And there was a high protein diet and whatnot. Nothing works because we're all different. Because everybody is a different Agni, different balance. Everything must be customized for each individual. Dhatus are tissues. And of course, actually, in English, rasa dhatu is much more than plasma. It's all the water in the body. It is plasma. It's the lymphatic fluid. It's all the water in the interstitial tissues. Blood is, it's not just your red blood cells, blood platelets. It's a lot more than that. And but this is a okay definition for class 1. Mala is an important word. Please remember, I don't like to use the word waste. Dosha, Agni, Mala, Dhatu, Indriya, and Manas. 5 words. Know them. Know the Sanskrit. This is Ayurvedic jargon. Like I said, dosha has now become such a common word. You can use the word with normal people. You can say, when you're talking to your clients or friends, you can say the digestive health. Agni comes from the word igni. Think of igneous. Igni, Agni. I hope that'll be easy to remember. Doshas we know, Agni, igneous, Igni, Agni. Ignition. Dhatu comes from the word dha, which means foundation, which means structure and tissues of the body. Dha. Dhatu, dha, mala, waste. How many of you do yoga and there is an asana called asana? It is called mala asana or mala asana. It's garland pose. Anybody? So remember mala. Mala, it's a waste product. Mala asana is garland pose. Let the mala come out. So what are the words that we have learned? Doshas. There are 3 doshas. Anybody? What are the 3 doshas? What are the 3 doshas? Yes. Okay. What are the 3 agnis? In Vata, Pitta, Kapha? Remember, Vata has, let me do a whiteboard here. All right. What have we learned? 3 doshas, Vata, Pitta, Kapha. We never write that. We all write VPK. So, just to know, from now on, whenever you see it, can you see my screen? Can everybody see the screen? Okay, perfect. And the 3 agnis, Vata has an agni, Pitta has an agni, and Kapha has an agni. Can anybody think of this agni? It's okay if you can't. Hey, yes, Cliff, thank you. Tikshna means sharp. So I'm just going to use the word sharp here. Slow, variable. Simple English word here. Yeah? VV, variable, Vata variable. Pitta sharp, easy to remember. Kapha slow. Kapha, imagine a Kapha walking really slowly. Kapha slow Agni. Pitta sharp, fire. Vata variable. And now let's put the Sanskrit there. Tikshna. Oops. Sorry, I put it in the wrong place. Hang on a second. That's where I'm supposed to put it. So sharp, tikshna. Yeah, slow manda. For now, just remember variable, or this is Vishama. Just remember variable, sharp, slow, Visham, Tikshna, Manda. That maybe you can remember later. These are very important things. Remember in Ayurveda, you're not just learning about a new system of holistic health, you're learning a new language. There's so much Sanskrit. I want to throw this Sanskrit right at you right from day one, because otherwise you'll be like, what is she talking about? Because we use the words like, oh, a pitta person came with Tikshnagni, and so you're like, what do you mean pitta person walks with Tikshnagni? So person came, he had immediately when he say the pitta person walked with Tikshnagni, Tikshna Agni means he was having 4 to 5 bowel movements. He was possibly having acid reflux. So the minute you say Vishmagni, oh, this person's constipated and has low appetite. The minute you say Mandagni or slow Agni, oh, this person's possibly kapha. This person. So remember the little example I gave you, 3 people came with a headache. Person 1 with headache had Vishamagni, person 2 who had skin issue had Tikshnagni, and person 3, Kapha, who had congestion and was sleeping a lot, was slow, had Mandagni. That's what we corrected. Okay, what else have we learned? We have learned about some theories. 4 goals of life, anybody? 4 goals of life? Dharma, Artha, Kam, Moksha. Beautiful. Thank you. You can review that. 2 fundamental theories. Theory of microcosm versus, yes, macrocosm, and similar versus dissimilar. Yes. So microcosm versus microcosm, similar versus 4 goals of life, 2 fundamental theories, 3 doshas. Great. Perfect. Do you want me to? I don't think you need to save this. It's already there. Yeah? All right. So actually, we are running out of time. I'll have to do the dosha test in the next class. I'm sorry. We are kind of running a little behind because Atul has to come on and do his presentation. Let me very quickly take the attendance. Robin, you are here. Robin, I see. Okay. Andrea, Clifton. Okay, Hannah. Morgan, you're here. Patricia. Is Patricia here? Okay, I see you. Olivia, Lauren, Ashley. Olivia, Lauren, I see you. Ashley, I see you. Okay. Stephanie, Sean, I see Sean. Stephanie. Okay. Megan, Mandy, Tegan. Megan, see you. Mandy, hang on. I see you. Okay, Tegan, I see you. All right, that's it. And okay, and Laura, I definitely see you there. All right, that's done. So take another couple of minutes break. I'm sorry, Cliff, I'm going to do this next week because we kind of went a little bit. I can just go on and on and on nonstop. I went over my time. So I'll do this next week, the dosha test. But still, we've thrown a lot of information. My aim and objective is that whatever, because this is your first introduction to Ayurveda, it should be, it should sink in. So, we'll do the dosha test next week. And a couple of minutes break, just 1 minute break. And then we're going to do our last presentation, which is really small, which is philosophical perspective of Ayurvedic medicine and compared to Western medicine. Okay, so a couple of minutes break.